Dear Natalia, dear friends in Ukraine, I'm sending you our heartfelt wishes that you and your families stay safe and that this terrible war is over very soon. I congratulate you on your strength to organize this meeting again, and I'm really thankful for inviting me to be part of it. I would like to present you how we started with FLS in Serbia. As we all know, a fragility fracture is a significant event for every patient who has it and also for their families, leading to substantial loss of quality in life and an increased mortality. But also fragility fractures are recognized significant risk factor for further fractures. Women who had fragility fractures are 5 times more likely to experience a second fracture within next 2 years than women who have not had a prior fracture. Yet 60 to 85% of women older than 50 with osteoporosis do not receive any treatment. And because of this growing, widening gap, the International Osteoporosis Federation, the world leading organization for fighting osteoporosis, launched the Capture the Fracture campaign in 2012 to substantially reduce the incidence of secondary fractures through the world. The most effective way to achieve this goal was through implementation of coordinator-based post-fracture models of care. Exemplary models have been referred as fracture liaison service, and over the time, Capture the Fracture has become a global program with a mission to reduce secondary and subsequent fractures through facilitating the implementation of fracture liaison service. FLS is actually a team of healthcare professionals that systematically identifies, investigates, initiates recommended treatment, and then monitor patients to optimize adherence to evidence-based interventions to reduce fracture risk. As someone who is very active in IOF, and I knew all this, but my actual problem was, where do I start with introducing FLS for the first time in Serbia? Well, the IOF and CTF working group have come up with several tools of support for persons like me in my position. One of them is at organizational level. We have something called the Best Practice Framework. It provides standards for the FLS across defined criteria, internationally recognized and endorsed standards of care for secondary fracture prevention. The standards cut across a whole range of things such as identification, evaluation, timing of post-fracture assessment. There is also a part regarding spine fractures, falls prevention, medication initiation, and review. There is a part with database and communication as well. Standards are divided in 3 levels: bronze, silver, and gold. And to help with achieving the best practice framework for the FLSs all around the world, unique partnership between IOF, interested partners, in this case Amgen in UCB, and University of Oxford, called CTF Partnership, was launched, and 5 broad pillars were made within this program. First of them is with the aim to influence policymakers worldwide to establish post-fracture care program with their national healthcare systems. The second pillar is to engagement of a global group of co-investigators and collaborators to assist in delivery of secondary fracture prevention system nationally and regionally. The third pillar, a mentorship program, provides a syllabus, training, and support within each country for the group of mentors who could then support the FLSs to get started or to become more effective in their own country in hospitals around the country. The fourth pillar is scalable solutions, an interactive benefit calculator to allow physician and healthcare providers to optimize secondary prevention service in their own national settings. And finally, the fifth pillar is the interactive database that houses all the information on secondary prevention of osteoporosis fractures worldwide through a portal in the Capture the Fracture partnership. The most important one for me to start with FLS in Serbia was mentorship pillar. As I said, the aim of this pillar is to develop a community of CTF's national mentors with knowledge, skills, competence, and performance in supporting the initiation of effective, efficient, and sustainable FLS programs with good patient experience. That is the most important thing in healthcare. The training for the national mentors includes the critical step of the FLS patient pathway from identification, assessment, treatment recommendation, and monitoring, quality improvement, and learn-centric approaches for adult education. I was really the lucky one to grow under the guidance of two world-leading experts in the field. Professor Cyrus Cooper, the president of IOF, and Professor Qasim Javed from the University of Oxford provided all necessary knowledge, support, and instructions how to start implementing the idea of FLS in our hospital settings. Through mentorship program, I learned that first thing to be done is to identify the team and to find FLS champion. FLS champion doesn't have to be a doctor, but it's important to be someone who is aware of osteoporosis consequences. Then to find influencer, the person who will influence the decision to have an FLS in our hospital, like policymaker, and who will pay for it, like Department of Finance. Third step that needed to be done is to make a map of care pathway. At the beginning, I just drew what I thought could be the map, and then along the way, I improve it and fill in more details. Target for FLS pathway and collected data helped us to create a piloting study and then the real FLS plan. One of the most helpful things on this journey was this. I went to policymaker with this post-fracture care infographics, where they could easily see two different pathways of care. But their attitude changed, because when they saw that if we have 10,000 adults with broken bones every year in our region, dedicated clinical service that finds, tests adults over 50 years with broken bones will have cost avoided in some smaller than 1 million, like in USA, but still very huge amount of money for our national health system. And it will be done avoiding in the same time avoiding 160 fractures, including 70 hip fractures, 50 deaths, around 80 hospital admissions, 300 bed days, approximately 150 operations, and 1,000 clinical appointments. After starting with FLS, now we are trying to accomplish these patient-level KPIs. They have been created by combining effort between the IOF Capture the Fracture Steering Committee, the Fragility Fracture Network, and the National Osteoporosis Foundation. First two KPIs are identification of all patients with non-spine and spine fractures. By KPIs 3 to 6, they should be assessed for fracture risk, have DEXA scan, full assessment, and have osteoporotic medication recommended in first 12 weeks after the fracture. By week 16, all patients should have follow-up, initiated medication, and strength balance training, and a year after fracture, they should have a follow-up to check therapy adherence. KPI 11 is probably the most important one for assessing the FLS, and it's data collection of all that has been done. And I hope that by achieving the 80% of KPIs at patient level in a year time, we will have all aims of definition of organization effectiveness fulfilled. Most importantly, the satisfaction of our patient with our service. But I will let you know next year, hopefully in person in Kiev, if we have succeeded in that. Дякую за вашу увагу.